Good afternoon. We're going to talk today about understanding blotchy rashes with a focus on atopic dermatitis. My name is Elizabeth Humbert. You guys know me from class as Liz. So let's go ahead and begin. So under our dermatologic history and physical exam, we have an onset of skin problems. It can start in infancy and early childhood. Some risk factors would be, winter season, allergens, family history. Description of the rashes would be dry, red, itchy patches that can be on the face, the neck, elbows, and the knees. And then, of course, light pink blotches and dry, scaly skin. Some diagnostic and therapeutic procedures. Obviously, in the clinical exam, they can do patch testing to look for allergies. We can do what's called a KOH prep, which rules out funguses. And then there's therapeutics to treat the infection if it's present. Depending on what it is, it might just be hydrocortisone cream. I've seen mupirocin being issued. If it's fungal, ketoconazole, or even over-the-counter clotrimazole, like what you use for athlete's foot. In the rare instances, we could do biopsies on it. So first and second line therapies, again, topical corticosteroids, frequent emollient use. So we usually recommend patients use like Aveeno or some of those thicker lotion creams that are specifically for eczema skin. So I believe there's like Eucerin, Aveeno, things like that. Second line would be things like tacrolimus and phototherapy, antihistamines, which would be probably like Benadryls or dupilumab. Oh my gosh, pardon me for the spelling pronunciation on that. And so those are some first and second line therapies. Some patient teaching and pharmacologic notes, steroid use. So you want to use those sparingly, steroid creams. There are emollients that you would put on post-bath that are steroids. So again, use those sparingly, just enough to cover the rash, because as you guys know, you don't want to have too much steroid treatments getting systemically in your system. And then avoiding triggers, so don't use soaps that have fragrances, perfumes, and this includes everybody who's going to be touching you. So everything has smells on them, right? So even hand sanitizer, soap, but stuff that we wash our clothes with, things that we wash our hair with should all be non-scented, unscented, basically things that touch your skin, or if it's for your child, things that are touching the child's skin. So that would include if the child's resting on you, make sure that your clothes are also being washed in scent-free things. There are the MOHSs. Laser is not for eczema, so note that there's not really that availability for that. Systemic diseases and resistance. So there are associated conditions. Asthma and allergies run together. So usually if you see somebody with skin problems, they usually have asthma allergies. There's also resistant concerns. So mupirocin resistance if you use it too much, or insecticide misuse. So using them too frequently can result in resistance. Quality of life and alternative treatments. So there are impacts to sleep, the way you feel in public. You've probably seen the commercials with people that have like psoriatic plaque psoriasis. They don't like to be seen, because people only look at that. There's also the mental burden of having skin conditions. I personally, I have melasma, so I'm always very conscious of it. So people that have eczema and stuff, especially if it's on their face or things that people can see, they can, mentally be very upset with this. So there are some alternatives. You can use coconut oil, oatmeal baths, but be careful again with essential oils since they are fragranced. You could have more skin reactions to those. Follow-up recommendations. So routine recheck in 2 to 4 weeks if it's, to see if the treatment being done is working. Monitoring steroid use so that way you don't get secondary infections. And then a referral to dermatology or psych if needed. If it gets to a point that a patient is so mentally upset by what's going on, they may need to go to psych. Thank you for watching, and here are the references.